Hello and welcome to another wonderful talk at the Positive Future for Health podcast. And tonight I'm thrilled to and delighted that Dr. Bob Gill has joined us to talk about the NHS and what is going on with the NHS. What's going on there? You may be wondering, what do you mean, Althea? The NHS is just the NHS, isn't it? Mm, let's see what you think. And I'm delighted he's joining us at the Positive Future podcast because I think it's something absolutely critical to know. Ask questions. What on earth is going on? So, I met Dr. Gill recently, no, actually, I think it was about a couple of years ago, wasn't it? When you were up at Croydon. And I came to one of his wonderful talks, and after he'd made the film The Great NHS Heist, which we'll be talking about, I'm sure. Yeah, I gave a wonderful speech, and I'm always looking for truth and open people's eyes and to their health, to look after their health. And what really touched me was that you talked about advocating for patients. I thought all doctors and nurses did that, but I don't think they are. And I was really touched by what you talked about and how you help people, what happened with your patients. Dr. Gill, can you tell us about yourself? How did you get, is it a lifelong journey of medicine for you? What's your life all about? What are you all about?
Thank you. So I've been a doctor for about 30 years. I've never really been a campaigner or an activist up until about 10 years ago. Um, and that was prompted by the closure of my local admitting hospital A&E, the maternity unit, and the acute medical and surgical beds. And following that downgrading, there was a threat to a neighbouring hospital in Lewisham. And I thought this was absolutely insane because patients with genuine medical need were struggling to get the help that they should have been getting. So to further cut local capacity didn't make any sense to me. And that was a sort of a journey of discovery um, that led me to become more active and publicly vocal. Um, I'm still a practicing GP. I also train other GPs in their final year before
Oh,
they're
wow.
let loose into the world.
Gosh.
Yeah, and part of the biggest thing for me was going from thinking that everything we needed to know the BBC would tell us to
Mm,
being dramatically woken up by particularly the censorship by omission.
yeah,
And
absolutely.
the particular event was triggered by a march in Manchester in 2013, which was a huge march. It was about the NHS. It was during
2013.
March 2013, yeah. And it was at conference time, at the Conservative Party conference. So the world's media was there. And I was so excited. I thought this would be all over the news. I rushed home, told my wife, stay up, we're going to watch this together. Nothing on the news. And I thought,
Wow.
oh my God, what else aren't they telling us? So that was a big wake up call. And that's what triggered my activism.
Wow. And then where did it take you from there? Did you just start talking about it from there? And how did the great NHS heist film come about?
Well, that was several years later. But what happened next was for me to try and join a group of people locally who were equally upset about the closure to Lewisham Hospital A&E.
Yeah.
Um, and I quickly found a group of patients and a couple of doctors who were leading a campaign there. So I joined that campaign. And through that, I met some very good people and I met some not so good people. and and you learn along the way. And I'd been very reluctant to speak publicly. And it was a couple of years into campaigning and realizing that some of the messaging coming out of the campaign was a bit restricted. So I thought I need to start speaking out myself. Um, and then the public meeting started gradually, and that led to the production of a film called Sell Off back in 2014.
Oh, right.
And then I was persuaded to do it again in 2016, 17. And it took because working full time and a family is difficult. But I think what we produced in 2019 stands, I'm pretty proud of what we made, given it was
Amazing. I mean,
just two people.
wow, wow. Was that with Ash Mahmood, or was that somebody else?
No, it was with a chap called Drew McFadden.
Oh, right.
And between us, sort of I was the light man, I was carrying stuff, I was
Right.
organizing the interview, so we had to do everything.
That's incredible. I don't know many doctors. I mean, I guess you have got your full-time family, you've got your full-time work in the
Mm.
practice, teaching other doctors and making a film. How did you have the energy? And
It
I,
was very demanding.
I bet.
Um, but because
Gosh.
we had raised m money through crowdfunding, I felt obliged to get it over the finishing line, and we did.
That's incredible. And how long did it take you to make the film?
It took too long. It took longer than I thought, um, because of various challenges, but the best part of 2 to 3 years.
Wow, wow. And it's as we're talking just off camera that it's once you make a film like that, it continues a calling card or something for people to learn about, and you don't have to always be talking about it. It's there, it's out there to be seen, and people can learn from that and see what's going on. So what happened did you get affected in your work from talking out and making this film? Did anything happen in your work, or that carried on as normal, or what happened in your work area?
Well, there had been pressure from the sort of local GP organizational body, um, and I just carried on. There came a point where there was a call from the regulator after
All
I'd
right.
been outspoken,
Mm.
and it was like being punched in the stomach. But I said to my wife, "Look, I know this is putting a lot on the line, but I have to carry on because I could see the effect on my patients." And I just naturally assumed everybody would be similar to me, but that was a big surprise.
I
Big,
know that's the thing. That's the thing, isn't it? I
yeah.
mean, I was a natural therapist for 35 years and shiatsu and reflexology, hands-on bodywork thing. And I wasn't political at all either. And I just gradually, I loved all this natural health and tuning into people. I gradually started to notice different drugs being flooded through my patients. Like there was, I don't know, like thyroxine would flood through, and then other things, and but everyone was taking it. I thought that's interesting. What's going on there? And then I found out about Codex Alimentarius, about the control of natural products later on, um, and I just noticed that people aren't respected in their decision. And we are just talking off camera about people don't, the medical people aren't they don't focus on you as the leader of your body. As they sort of go through protocol. They don't always ask you, what do you think, or is it what you want? I know, when I had fibroids, that my gynae said, right, we'll get you booked in for the operation. I said, hang on a minute, life-changing operation. Can I think about it, please? 2 weeks to book it in, and she said, oh, what do you mean? Everybody books it in. I'm like, well, I don't want to, all my bony bits removed, life-changing event. Let me think
Mhm.
about it. It's I find that people in the medical profession are so clever, so educated. Um, it feels very daunting to question your doctor or medical professional. The It seems like I feel stupid,
Mm.
to question something. But
Well, there's a power imbalance, isn't there? Um,
definitely,
but it's the other way around also. Patients come in expecting a prescription straight away, don't really want to engage in any alternatives. So
wow,
that's what I'm facing most of the time.
wow,
When I say
wow.
to them, you don't really need treatment, why don't we try and manage this through some, for example, dietary change? They glaze over. They say, look, just give me my pill and my behavior will carry on as normal.
Wow. I that's gosh. And how many of people thinking like how many doctors in your medical world are thinking a bit like you in that way?
It's too few, to be honest. The system is designed, it's gradually evolved into a very sort of top-down um, managerial approach, and the funding of general practice is more and more conditional on meeting certain targets, which some you couldn't disagree with, but others are about prescribing. And if you don't prescribe to the max, then you don't get your income. And they made a greater proportion of your income dependent on meeting these targets. So financially, we're controlled. And then you have a lot of protocols which are driven from above, bodies like NICE, the Center for Clinical Excellence. And
Yeah,
you feel, if you go against these protocols, you feel medico-legally vulnerable. So you're in certain ways you're incentivized, and you slight coercion into sticking to what everybody else is doing.
quite. I mean, how have you managed to have a decent wage and to advocate for people in the way that you feels best for them instead of just writing the prescriptions all the time? How do you manage that then if that's the pressure that everybody feel, all doctors feel? Um,
Yeah,
do you just
so
live off less or something, or how do you cope with that?
well,
Because it's real, isn't it? We have to pay bills and mortgages and all that.
yeah, I think the key is a lot of changes that have been forced. Well, we've been there've been various attempts to persuade us to do. Generally, they destroy continuity of care, and
Ah,
once you downgrade continuity of care, your workload goes up, and the complexity goes up, and the duplication of effort goes up. So although these other practices might be earning more in terms of incentive payments, they're no better off because they've destroyed what made general practice efficient. But I've held on to that. So I have better job satisfaction, I have good continuity of care, and I can forego the income because I know I'm not actively damaging my patients.
It's a value behavior, isn't it? I remember when my mum was in she was in a nursing home, and you talk about continuity of care. It just made me think of this that they had a restructure, and they had three floors. One floor was dementia, one floor was another, and then I don't know, and then there were three floors, and they changed around the management all around, and they kept changing them about, and there was a lot of grumbles from the staff because the staff, my mother was dementia, and they they learnt the nuances of the guests, of the residents, and they knew that that behavior was because of this and this and that, and this is how they like to have their pajamas on or whatever it was. So they created love and support, really, comfort,
Mhm.
familiarity, very, very important for dementia people. And but they kept changing it around, and they the staff pointed this out. I thought, why would they do that? So it's like it sort of breaks the individual control. It's like a top-down control, as you said. It's we'll command what goes on, but the other end of it meant the patient suffered.
Yeah, and I think part of it is also to prevent staff attachment to the patient.
Why would they do that?
Well,
That
if
seems
you
silly.
if you have devoted staff who are attached to their patients, perhaps the standards they want to work under would be higher. So they're deliberately alienating, they're erecting barriers between the doctor and the patient. And the barrier is reaching your financial target. The barrier is following a protocol. The barrier is fear of litigation. And these are externally erected barriers. And unfortunately, most doctors have now just accepted this as part of their job. And
Wow.
it's become normal to them. They don't even realize they're in a professional straitjacket.
What they don't realize it then. Do you talk to your fellow doctors and medical staff?
I used to talk a lot more, but there comes a point whereby you think, when something is blatantly obvious and they still refuse to see it. The most obvious thing at the moment is the downskilling of the staff. So actually, there's an active program of replacing doctors with non-doctors. So,
I've
for
heard of
example,
this.
replacing GPs with a physician's associate who's done 2 years of what are called medical studies, whatever they are, compared to somebody who's done 5 years university and 5 years clinical experience. And GPs have been incentivized to take on physician's associates, right? Which is undermining the profession for the next generation of doctors and subjecting your patients to higher risk.
This is so scary, isn't it? It's so scary. I mean, even when I was in hospital recently, last year, for a short time, just a few days, the staff were changing all the time, and it's difficult to sort of. I like to get to know people around me, around my neighborhood, around me in hospital, whatever. And it was hard work. I had to learn about 25 names, and it was it was hard going. And I thought this is I had my wits about me. What if you had an old biddy who's confused and doesn't know what's going on? I think that would make somebody feel very alone and isolated if you just had strangers coming along. Maybe that
Yeah,
create.
and
Mm,
exactly, the patient experience is worse. But what's
mm,
even more important, well, just as important, is experiential learning. So if you're not following that patient through their illness, you don't learn. You don't learn what's not in the textbooks. So that natural learning that would occur with stability has
yeah.
gone out of the window. And if you look at what they've done to medical training, they used to, when I was training, the shortest job you would do would be 6 months on a ward. So you would be gaining competence at sort of 3 or 4 months. You knew the ropes, and month five, month six, you're embedding that knowledge. You're becoming confident. You're becoming experienced. Now those rotational jobs are maximum 4 months. So it's in a way they're creating a generation of doctors who lack confidence and will resort to doing as they're told rather than thinking for themselves because they just lack the experience.
I think that's the key. That's the key objective, isn't it? What with Agenda 2030 and um, to have top-down control and
Mm.
to big pharma control. And I think it sounds like it's very similar pattern that's happening all over. I mean, my kids are at school at the minute, and it seems very similar format that it's separating the parents from the children, the doctors from the patients. It's top down control. It's do what you're told and don't ask questions. And if you
Mm.
do, it's a problem. It's a big problem if you ask questions and question what's going on. Well, you can leave then. It sounds very similar, sort of reflective in the school world as well. And I wonder how many other worlds it goes on.
Well, I
Um,
think it's across the board. So the political consensus since the late 1970s is neoliberal policies. Neoliberalism is privatization, it's deregulation, it's less tax for the rich, and it's this managerialism. There's been a mushrooming of the professional managerial class, which
okay.
has become the intermediary between a professional and the client or the public. So you have that in the police force, universities, education, healthcare, whereby the people with the responsibility have the least control, and the people who never engage with the public are dictating what happens.
Yeah. It's scary. It's really scary. Dr. Gill, can you tell us about when I had your talk, will you share with us about your patients and how you were advocate I was really touched by how you advocated and what happened to your patients. Can you share, we're talking about the systems, but what about the real people that are experiencing
Yeah,
what
so it's I'm no longer shocked when a patient with an obvious diagnosis is sent back from the hospital with it being missed. It no longer shocks me. If I went back 10 years ago, this was a very unusual incident to be occurring, right?
wow, 10 years.
Yeah, so there's a significant decline. There had never been the case where I would worry that the doctors or the hospital doesn't know what they're doing. one case in particular, after the decline started locally, was of a lady who was in her 70s. She happened to be the chair of my patient participation group. She developed severe back pain. She was an asthmatic. She'd been on steroids, and I suspected an osteoporotic fracture of her spine. The X-ray confirmed that there was a fracture, and it explained her pain. And several weeks later, she developed numbness and weakness in the legs and loss of bladder control. Now that those symptoms
That's
should
nerves, isn't it?
yeah, that should ring alarm bells with anybody, right?
Yeah.
So I sent her into the hospital saying, look, you need to exclude spinal cord compression. And she came out 3 times. And on the last occasion, they were trying to send her home. In fact, the penny dropped when she went in for physiotherapy the following day and she couldn't stand. She ended up paralyzed, totally preventable paralysis. That was
Wow.
at one hospital.
Wow.
She went to King's, had spinal fixation, then was transferred to Lewisham Hospital. So this is now 3 hospital trusts that were involved. And 3 months later, when her blood test started to become abnormal, somebody inquired about the bone biopsy when you did the spinal fixation. It turned out she had a cancer in the spine. So this is multiple failures. 3 major hospitals in southeast London led to this lady's preventable paralysis and subsequent premature death.
Wow.
Now, the family were beside themselves. She had 2 daughters. I said, look, if you want to fight, I will fight with you. I went to meet with the medical director and somebody from the senior management in one of the trusts, and they just lied to us. They said they were, we didn't look at the scan. They kept pointing the finger at each other. And ultimately, she decided to take this to a lawyer. And the lawyer said, it's going to now your mother has died. It's going to cost you more for the legal case than you're going to get out in any payment. So they didn't take it any further. So
But the
that's
thing
just
is,
one example, right? But there are many more
uh,
like that I could give you.
it's awful because what they're doing and restructuring of the NHS like this, as you say, it's weakening the ability of the doctors, it's disconnecting the communication, and ultimately the patient is just suffering. I mean, she died, for goodness sake, a preventable situation.
Well, another example, which happened quite early on, was that of a doctor's wife who developed abdominal pain. They were so overstretched in the A&E department. They said, look, we want to do an ultrasound scan on your abdomen first. They made her walk to the ultrasound department, during which time her appendix perforated. So nobody's safe in the current system. Even if you're a relative of a doctor, it's not going to get you anywhere because they have manufactured a crisis. How have they manufactured it? They've reduced bed capacity. We've got half the number of beds per head of population than we had back in the in the 1980s. They've marketized the NHS, they've outsourced services, they've given the private sector the easy, most profitable work to do. They've saddled the NHS with debt, private finance initiative debt. We've borrowed 11 billion. We have to pay back 80 billion, at the end of which we won't own any of the hospitals.
Any of the hospitals.
Yeah, so in effect, you've transferred ownership, you've saddled the NHS with a debt liability, you've reduced capacity, you've essentially shrunk the wages of the staff. They're like 20-30% less than they were in
Really?
2006.
Gosh.
So none of what I'm describing to you is some accident. It's all an
Yeah.
effect of deliberate policy, which has been set out in one act of parliament after the other. And whichever government comes in, they blame the outgoing government, but they actually follow the same policy stream. And now what we have is a system it still has the NHS logo, but it's nothing like the NHS.
Yes.
It is
Yeah.
now, the NHS in England is now 42. new legal entities, which are called integrated care boards, which are based on the American system. And these are public-private partnerships which have designed to deliver profit through the denial of care, publicly funded.
It's crazy, isn't it? It's really scary because it's like a house of cards, and people, good people like yourself, trying to sort of function in it, trying to advocate for patients. I remember hearing on UK column there was Debbie Evans, a nurse, and she said that when she did it the old-fashioned way, that she would have ward experience. She'd go and sit with the people, have a cup of tea with them, how you doing, dear, and all this sort of thing. And it was hands-on hard graft work, wash the patients and everything else. And she said these days it's all shifted, that new nurses, for example, are they have to go to university to learn. They don't go to the wards. The wards is a secondary factor. So it sounds like it's similar across the board. And um what do you think? It's scary. I mean, where is this all coming from, Dr. Gill? Is it from the government? Where does it come from? Why is all these entities being developed? Since all COVID, I've noticed many new departments are just popping up left, right, and centre. And
Well, it has a much longer gestation, I'm afraid. It goes back to Margaret Thatcher. We
yeah,
had the creation of a management bureaucracy in the early 1980s. You had Lord Griffiths of Sainsbury's, who introduced managerialism, supposedly to bring in the private sector efficiency. It did absolutely the opposite. The overhead cost of the NHS went from 4%. It must be running between 20 and 30% now. So that's money being sucked out of the system. Um, the the architects of all of this, amongst one management, most notable is management consultants McKinsey, who've been involved in the NHS restructuring since the 1970s. In fact, Nicholas Ridley produced a document back in 1977 called the Economic Restructuring Group, talking about privatizing all the national utilities and talking about the NHS being broken up into separate profit centres and having to proceed by stealth.
I remember that. That rings a bell.
Yeah, and then you had Oliver Letwin's document in 1988 talking about privatizing the NHS and breaking it up into public-private partnerships, as we have now, as I've explained already, and going from a system of public funding to universal insurance. What will happen is you'll have universal basic Skid Row insurance through the public purse, and then the middle class will be encouraged to get top up private insurance because the NHS no longer will do a broader and broader range of what we take for granted at the moment. They'll start excluding procedures such as joint replacement or cataract surgery.
And this is what I hear, like in America, it's all privatized there.
Mm.
And that, if you don't have medical insurance, but then there's no guarantee everything's going to be all fine for you anyway. That's another story. But when people don't have insurance, for example, they're not in the paid system. Well, that's it. I heard of people sort of jumping out ambulances because they didn't want to pay the cost. They hadn't got the money.
Yeah,
Things like
well,
that. Is that where we're going?
the American system, funnily enough, the number one reason for household bankruptcy in America is medical bills. And the majority of the people going bankrupt have insurance. So we are copying a system of private insurance whereby the people with the private insurance only find out they're not covered when they're seriously ill. And the Sunday Times produced a document, an article back in October 2022 of a King's Counsel, a Mr. James Guthrie,
Oh, I
who
saw this. Yeah.
yeah, whose Bupa insurance went from £6,000 a year to £164,000 a year because he was bad enough to develop a cancer which required treatment. So insurance is based on how much you cost the insurance company the preceding year, and they will assess your risk according to how much you cost them. And if you become sick, they will price you out of cover. Insurance is for the insurance companies, it's not for the patients.
Wow. And then what do you do if you get sick? Then you go to the NHS and then you spend whether you get help, the right help or the not right help, or you're months down the line, and maybe but like that poor
Well,
lady treated
yeah, well,
properly.
we have denial of care without people calling it denial of care. If you lose your A&E hospital and you're seriously ill and you have to travel 10, 20 minutes, half an hour further, your risk of dying has gone up.
Yes,
So that person who's now dead has had their care denied. If you're on
yes,
a waiting list along with 8 million other people and you waiting for your heart bypass and you die of a heart attack while you're waiting, well, that's denial of care for you too,
yes,
right?
absolutely.
Or if you do have the means or you decide to remortgage your house, then you skip and go down the private sector, pay out of pocket. Well, then the NHS has denied that person care as well. So there are many ways of denial of care, and it's happening now, um, and it's only going to get worse.
But where's it all go? And Rose has asked a question. Rose says, I wish doctors would say, here's a site to look into help with depression and a guide to mindfulness, meditation. If this does not work, come back as soon as possible, not just through antidepressants at the first aid to help. And we just talked about that earlier, Rose, didn't we? About Dr. Gill was saying people come in expecting their prescription.
Yeah, so I get people who've been feeling depressed for a week or two, expecting they've just had a life event, they've just had a bereavement or something along those lines. And what we all took as normal grieving has now become medicalized. And the guidelines say if they've been feeling low for a couple of weeks, start them on an SSRI. But, you know, I don't do that.
Yes, yes.
You spend longer, you see what support network people have, you tell them, look, your emotions are entirely normal. You're a human being after all, you're not a robot.
Normal things. A normal, sensible, thinking person.
Yeah. But
Oh,
as primary care becomes under more and more pressure, as the doctor you're seeing has no relationship with you, they don't know you from Adam,
yeah.
and as the guidelines say, well, you must start this person on treatment, most people are going to follow the path of least resistance, aren't they?
Absolutely, absolutely. And Sonny's saying, we're copying the American system. Yeah, what we were saying, wasn't it, Sonny? Dr. Gill, having to pay for insurance just to get a doctor to treat you. I had a fibroid, and I told you briefly, my story a bit, but they wanted to they put me on the cancer track, and I was seeing like lightning. They were calling me up saying, "Are you coming tomorrow? Are you coming?" It was like a whole team of people in the cancer system, and it was a fibroid. It was clearly a fibroid. There was no indicating factors. I mean, I had blood tests and all the rest of it, and I thought, why are they doing that then? And I got the feeling like they want to get paid. They want to get this case sorted. What do you think? What's your perspective about all of that? What I just said. What's your take on that?
I think that's down to the referring GP. That's not the hospital's not plucking you out of thin air. That's
No,
down
no.
that's down to your GP, and I can't second guess what he
Mm.
or she saw that was worrying, but that's maybe one demonstration of how if you have inexperienced, low confidence doctors, they're going to refer a lot of unnecessary people and generate a lot of unnecessary anxiety, further clogging up the system. So you can see how dysfunctional all this privatization and marketization has caused the system become inefficient, ineffective, and not very patient-centered.
Absolutely. And Dr. Go, where's this all going? How do you see things? It's been 10 years, you said that it wasn't like this 10 years ago. So it's all been, but you mentioned like it goes way back to Thatcher, but you're saying that it really started changing about 10 years ago. What was different 10 years ago? And where's it going?
Well, for me, 10 years ago, I had a hospital 2 miles down the road where most of my sick patients went.
Yeah.
where most of my pregnant ladies went to have their babies,
Oh wow.
where we used to go for postgraduate education and you get to know the consultants. All of that has gone.
Oh wow.
That networking, that natural learning, that
Yes.
patient in a place which is local to them, where elderly patients can have their relatives visit them, where you've got staff satisfaction working in a small maternity unit,
Yeah.
where you've got camaraderie, that has gone.
Wow.
Now, up until that point, I'm busy running my surgery, trying to pay off the mortgage, looking after two young kids. There's only so much headspace.
Yes.
But when you suddenly dramatically see the decline in the quality of service your patients are getting, you think this is outrageous. They're planning a further cut. And I went, looking for supporting colleagues nearby, and they were all mute.
Oh wow. Wasn't it, didn't you say that you gathered people together and when the crunch came they all went quiet? Was that what you mean?
So
That
that was another meeting at our local clinical commissioning group, whereby they would stop the doctors from working, call us all in to a meeting for an afternoon. They would pay for locums to cover our surgeries. Uh, you can imagine how much cost that meeting is. If you've got 50 to 70 health professionals sat in a room
mm,
listening to managers to telling us how to do our work. Anyway, before the meeting started, I went and I spoke to about a dozen other GPs saying, look, what is your experience with the closure? How are your patients doing? All of them agreed with me. So I took it upon myself to challenge the chair of the clinical commissioning group, who's supposedly a doctor. And I said, look, you're painting this rosy picture of spending less money and getting better care, but this is you're gaslighting us.
that's not the reality.
This is a fantasy, and it's not just me. Look at all my colleagues behind me. Put your hands up. Did anybody put their hands up? And it was at that point I said, I'm not going to bother with these jokers anymore. If I'm
Mm,
going to be effective, I have to join like-minded people
yeah,
and put my effort where it might actually have an impact.
absolutely. And I wonder whether it's, it's government and public to private, but there's a whole nother kind of big pharma aspect to all of this. I mean, during COVID, I was watching the behavior and listening, keeping an eye on the HMRA and Debbie Evans was all, on hot on that one. And it seemed like it was all run for the show of Big Pharma. Apparently they are funded over 80%. Bill Gates and Big Pharma. I
Mm.
mean, if that's the case, of course they're going to, jump to the fiddle, the tune of of who plays as the flute, as they say, and that's really really scary. If
Yeah,
that from the
it's
top.
it's utterly insane to have a regulator paid by the
Yeah,
people that they're supposed to regulate.
exactly. What
Um,
they going to do?
so this is obvious, uh, route for corruption. In terms of the pandemic, by this time, I'm of the state of mind I can't believe if the government told me today was Friday, I wouldn't believe them. I'd have to check for myself.
I feel the same.
Then they started to tell us that this virus was deadly.
Yeah,
Then they said, Let's protect the most vulnerable." All right, that sounds reasonable. We didn't have much information to go on. But then they started to do things that, through accepted public health uh, agreements, out of the window, like wearing masks and
yeah.
social distancing.
Mm.
Um, and then I heard quite early on in 2020 of a very respectable, highly accredited person saying this virus looks man-made, right? And then
Yes,
so anyway, there were people by the end of the year, there were people literally queuing up outside the surgery demanding their vaccine
I know. Yeah,
because Project Fear
right.
was so effective.
Absolutely.
The other thing that made me very suspicious was the BBC, which is effectively a state broadcaster,
Yeah,
was happily putting up the death toll every night on the BBC. And I thought, well, surely this is showing the government incompetence. So what purpose is this serving? It was Project Fear.
Yeah,
That
absolutely.
was
Agree.
the government were very happy that the BBC were putting up a daily death rate
Yeah,
um, for supposedly COVID related deaths that would scare the population into staying locked up in their houses,
yeah.
not speaking to their neighbors, and
Freaking
waiting
each
for this
other out.
yeah, waiting for the saints at Pfizer to deliver us a miracle cure.
Yeah, exactly. And of course it's ricocheted through all communities, all relationships. You know, we were all put up against family and friends and neighbors.
Hmm.
It was like a cancer. It was at the time, just before the lockdown. My mom, we had her funeral just before the lockdown, and so
Mm.
my mom was a very popular lady. She had loads of people coming from all over the world, and they cancelled left, right, and centre because, of course, it was all heating up at that moment, or left, right, and centre. And my great auntie in America, she said, Alfie, I'm not going to come because it's all scary and all the rest of it. And I said to her exactly that, Dr. Gill. I said to her, "There's no virus here. It's a virus of fear.
Hmm.
Fear is the only virus here." And but people swallowed it.
But
And mm,
I learned late. Well, it was obvious that quite early on that the people who were getting very ill were vitamin D deficient and overweight.
mm,
Where was the government advice to boost
yeah.
up your vitamin D, to get some exercise? If you were wanting some exercise in the park, you were getting arrested.
Exactly.
So
So why is it? I mean, I've heard that doctors don't learn more than a page and a half, or nurses. My friend's a nurse. She told me. I said, "Is it true that you only learn a short bit about nutrition?" Like Rose was saying about why don't doctors suggest and offer like things like yourself, like natural ways? Think about your diet. Think about who's your support network, and why is it not? Why is that not happening? If it's all known things, and these medications, natural medications, have been around for thousands of years,
Mhm.
why aren't doctors, nurses, or doctors suggesting to their patients like you are?
Well, so you know, my awareness has increased, I suppose, in the last decade. Um, People used to tell me stuff anecdotally, and because I didn't read about it and it wasn't in the guideline, I would actually
Ah,
dismiss it. Yeah.
right.
People
Yes.
would tell me various things, and I regret not being more open-minded about it. But
Well, you are now,
I
so
am now.
it was
And,
seed.
I think it was about 7, 8 years ago, I read about nutrition, I read about intermittent fasting, I read about low carb diet, and I thought, nobody taught me any of this in medical school. Uh,
Wow.
I'm going to try it on myself. And I had fantastic results. I was more alert. I wasn't feeling tired after lunch. I dropped almost 2 stone in weight
Wow.
within 6 weeks. So
Wow.
then I became a convert to lifestyle medicine. Um, but again, the number of people who make change when I give them a talk about lifestyle medicine compared to the number of people who are running to the pharmacist to get this slimming injection.
Mm.
I
Yeah.
get hundreds of letters from pharmacists prescribing Wegovy and all the rest of them,
Mm.
but hardly anybody comes back to me saying, I'm following your lifestyle advice. Look how well I've done.
Wow.
People,
Mm.
the majority of people are conditioned to want simple solutions which require no effort or change on their part
Yes.
because that has been taught out of us. The
Yes.
generation who had common sense and were willing to put effort in,
Yes.
they're not listened to anymore.
Wow. But I do believe, there is a certain balancing aspect to being human, that maybe we go all the way some other way and don't give away our power. We trust the process of the system, and we don't sort of listen to our own needs, or we don't realize we're the ones that make the changes from within. And maybe it's going the other way, but I do believe balance will always resume one way or another. And I mean, as a natural therapist, I find what happened in COVID time that people were starting to go within. They were starting to be confronted by their emotions, by that relationship that wasn't working, by their kids that they didn't see all day usually, and suddenly, people were very acutely aware of their world and their feelings and their thoughts. And as a natural therapist, I know that healing is from within. List figuring out what's right for you and taking sovereignty, isn't it? Taking control of your own needs, taking that action, maybe supported, but it comes from within. And so maybe it's a good thing that ultimately, trying to look at the good aspect somewhere.
I think for some people, like for me, the lockdowns and COVID. First of all, I never shut my surgery for a day.
Amazing,
Um,
amazing.
I
Well done.
just
Well done.
I just made sure the waiting room was never crowded and the windows were open, right?
Yeah, yeah.
I went to see people supposedly COVID infected at home.
Mhm.
I thought, well, I'm reasonably fit. I'm going to get it sooner or later. Well, let's carry on, right? Um, there was so much money thrown at giving the vaccines, and public demand was off the scale.
I
If I'd
know.
refused
Yeah.
to give them, there would have been a riot. I would have lost. So,
Wow.
we
I know.
did.
Yes, yes.
I th-
Cute. And you couldn't get through to anybody. It was
no, but
you're stupid if you don't do it, sort of thing, wasn't it?
I was still not of the mind that this could be harmful. I thought it was probably unnecessary in a lot of people, but I didn't envisage it would be harmful.
Yeah,
It's only after the second vaccine I started to notice my patients. The most common thing was menstrual irregularity.
yeah.
Then I had a spate of people with Bell's palsies, that, a cluster of about
Wow.
six that I hadn't seen in 30 years prior to that. And I thought, hang on, something is not right. And I pulled out the system.
Wow.
I didn't give any boosters. We took a significant financial hit because for most
Yeah.
GP practices, this was bonanza.
Yes.
And that's all the GPs that were hiding from their patients during lockdown were suddenly smiling from ear to ear
Yeah.
because they were lining their pockets with a very generous scheme to roll out the
Yeah.
vaccines.
Yes. And so it took you observation of your patients and complete. I mean, I feel your heart, Dr. Gill. I mean, I'm sure you work just as hard as any other doctor, but you have heart and you care about your patients clearly. And you're sort of fighting for the how things are supposed to be. But it took you to notice what was happening with your patients to put the brakes on for that and not to let the financial side attract you.
I think the because my eyes were opened in terms of what they're doing to the health service. I was not going to be suckered in
Right,
by what the government were doing.
right.
Um, but most people, unfortunately, they would prefer ignorance to information.
It seems to
Um,
be.
and
Yeah.
there's something very psychological about listening to authority. Uh,
Yes.
we are conditioned to listen to authority.
Yes.
It's the evolutionary psychology. When we were living in caves, we used to listen to the best hunter, the most
Yes.
muscular the man who came back with the goods.
Yes.
But in modern society, you can have a right charlatan taking society in totally the wrong direction, and that's what we
Absolutely.
have.
That seems, I think you've hit it on the nail there. That's exactly what's happening. And anybody's listening, do please ask Dr. Gill if you have any questions. Just wave your hand if you want to unmute. Or we've got a few minutes left. We've got 10 minutes left. If you'd like to write something in the chat box so you can see your questions. What do you think about end of life policy going on at the moment? There's a lot of freak out about and the Liverpool Care Pathway. I know it's not called that anymore, something
Hmm.
else. I saw a poor chap. I was racking my brains. Who was it? It was Eric. Who I forget his name. There was a lot of supporters at the time, and they basically killed him off. And it seems to be a massive deal at the moment. Of even I mean, even I'm scared. I'm over 50s, and it seems to be 50s plus. You're in trouble. If you don't get better quick. I've been hearing so many stories about people who went under because of all the medications, and when they took the medications off, they recovered. What do you think about end of life and um, Dr. Gill?
So there is a push for assisted dying, assisted suicide.
Yes.
Given what I've just outlined in terms of how our caring governments have dismantled our health service,
Mm,
I put it to you that this is not well intentioned. If we look at what's happened in Canada and in Holland, what started off with a few patients with life-limiting illness has now extended to people who are depressed because they're in debt. In Canada, they're helping people die with depression, um, not having a life-limiting condition. So this is about, this will be mission creep.
but
Um,
Dr. Gill, this is murder you're talking about, isn't it? This is inconvenient lives and saving the pennies,
well, yeah, I think
following following protocol and do what you're told.
I would not trust any government with this power. What it does, unfortunately, it will normalize and create a societal pressure on the vulnerable and the sick to say, well, I don't want to be a burden. Why don't I take this option?
I
In
can so
30,
see it happening.
in 30 years, I've only ever been asked once by somebody who had a terminal illness, Doctor, would you help it along for me? And I said, look, what are you worried about? And we talked about it. And he said, I don't want to be in pain, this, that, and the other. I said, we've got very good palliative services. And when it comes to it, in my experience, none of my patients have really suffered an agonizing death. And never conversation never happened again. So the government
Oh,
wants
Dr. Gill, I'm moving to your area. Where are you? I'm coming to your area. I want you as my doctor.
the, the government are creating a false perception that there's a huge demand for this when there isn't. What there is a demand for is respectable, ethical palliative services.
Yes.
Um, and this would just create a pressure and a normalization amongst society that certain people's lives are not worth living.
That's exactly what it is, isn't it? And all this poor stuff going on in Palestine, it's just a massive reflection of another a dose of the same kind of mentality. Other
Yeah,
people's
a
certain lives
political a
are
political
unfair.
class who can
Yeah,
oversee genocide and support genocide, I don't
exactly.
trust with my health.
Exactly. And Mike's asking, he says, hi, have you looked into the work of Jamie Andrews, who's exposed what the PCR tests were really testing for?
I've heard, not that person in particular, but I've heard that the PCR tests have a big problem with false positives. A lot of the coding, particularly in America, was dubious because hospitals were being paid every time they had a positive PCR test. So there was a financial incentive in overdiagnosing and putting COVID on death certificates. So I'm aware of the concerns. There was a guy called Gary Mullis, I think it was, who was the inventor of
Yes,
PCR.
yes, Kerry Mullis. Yes, the event, the
Yeah,
he got a Nobel Peace Prize for
that's
the
right. And he
PCR.
said this was never designed as a diagnostic tool. So it was a mechanism of inflating the deaths so that the BBC could reliably scare everybody to death.
Exactly. And Margaret says, I fully believe all you say. Your family should be so proud of you. And I ditto. Here, here. I think you're absolute star in your field. And thank goodness for you. Thank goodness. There's some decent doctors like yourself. And Margaret says, what about the objective of dehydration and of patient end of life? Very scary time for her, for Margaret.
Yeah, I think I'll tell you a story of a patient who, when I was in hospital back in the early 2000s, he'd had a massive stroke and we didn't give him much hope. He was just kept hydrated. I think it was a subcutaneous drip he was on, and we didn't expect him to see out the week. 3 months later, after his wife had given all his clothes away to a charity shop, she came in very angry saying, I've got no clothes to take him home. He walked home. He walked out of the ward. So the idea that anybody can reliably predict the outcome, we know that they can't. Studies have been done showing that 60-70% of doctors get the estimated life expectancy wrong. So um,
How, what percentage?
60 to 70% of the time they're wrong.
Wow,
Yeah.
that's scary.
It's not an exact science. You cannot tell.
Yeah.
I have another patient who only recently passed away, but he was discharged 2 years ago, not expected to see out a month. And he survived because of the care and attention of his devoted family and the district nurses. His quality of life wasn't great, but he was happy to still be alive.
Yes, and there's a lot of on the UK column, and I know Jackie Devoy made a film with Ash Mahmood and Naeem called Playing God, and there's another one, A Good Death. I think they made two films
Hmm.
all about this, and it's really quite concerning, isn't it? I'm glad that we're all asking questions, that
Hmm.
people are waking up and they're asking questions and concerned about this, as they should be.
I think
Um,
people should ask themselves, is this the same government that is so caring for the terminally ill? Is this the same government that's making people wait in corridors for hours for a bed? Is this the same government that has cut the winter fuel allowance? Yeah. So this
yeah.
inconsistency should make people sit up and ask themselves what's really going on.
Yes, and those who didn't join us, who joined after the beginning, Dr. Gill made this amazing film called The Great NHS Heist, and I'll put it with this recording, and also how to get in contact with Dr. Gill, who's you can contact him on Twitter. I'm going to put that with the recording. But Dr. Gill, absolutely. I mean, what can people do? Where do we go from here? How can we help ourselves? How can we help the situation?
I think the best thing is try your best not to become sick in the first place.
Okay,
Um, Eat well,
got it.
eat
Yeah,
nutritious food, organic if you can, get plenty of sun, uh, have a good network of friends and a social life, um, and try and have a good night's sleep and keep the stress levels down. And hopefully, you don't need to see a doctor or go to an NHS hospital.
wonderful. And I hear in the East that they pay the doctor until they get ill, and when they get ill, they don't pay the doctor. So it's their job to look
Keep
after
you
the
well. Yeah.
people. Yeah, very different.
Prevention is better than cure.
Wonderful. You're talking like my father. I mean, this is proper, sensible things we all used to know. We used to know all these sort of things. Proper, proper, thinking.
The
Uh,
other tip I would give you is that if ever your doctor is suggesting you go on a tablet, ask them two questions. What is the number of people needed to treat to save one life? Numbers needed to treat. And what is the numbers needed to harm, to cause somebody significant harm with this new intervention? And if the numbers are you got to treat 500 people to save one life, I put it to you, that's not a very good intervention.
okay, you got that, everyone? Gosh, you just have to have your wits about you, isn't it? Think sensibly. Think, is this the right thing for me? And I mean, I remember going into hospital with my little darling little baby. He'd fallen off the toilet at 1 year old, and he jammed his toothbrush and he damaged the back of his throat. So he was screaming, poor little thing. I took him in, and they were questioning me, and I was like, they were having a full-on focus to me, the mother. I
Mm.
mean, where's the thinking? Why, if I'm an abusing mother, why would I bring my baby to you to help? But
That
of
that
course,
again is the sort of medico-legal fear hat they're wearing. The other tip I want to give you, I just remembered, is if you're unfortunate enough to need the hospital, make sure you're seeing a doctor, not a physician's associate, because the
thank you.
risk of you getting a wrong diagnosis or delayed diagnosis will be much higher.
So what's it? It's what's it called? Associate
Physician's
physician.
associate, they're not a doctor, and they're acting a lot of the time outside of their competence.
Wow, thank you very much. And Mike says, interesting. Jamie Andrews works on Substack, debunks the genetic sequence nonsense, and proves that only detects the charge of the sample. Thank you, Mike. Thank you so much. And Rose says thank you to both of us. And thank you so much, Rose. Okay, so we have come to the top of the hour. If you would like to go and have a look at the great NHS Heist, which is I pinch myself. I can't believe it. A doctor, full on working with a full family, full business, full on doctor hours, has made a film just with one other person. It's incredible. So do go and have a look at that great NHS Heist. And if you want to get in contact with Dr. Gill, he's on Twitter at Dr. Bob Gill, and I'll put the link with the recording as well. But Dr. Gill, thank you so much for sharing your doctor experience and pointing us in the right direction. Thank you so much, and lucky us to have a doctor is still working in the NHS who thinks like you do and behaves like you do. I'm so grateful. I'm coming to you area, pick up with you.
Thank you very much.
Thank you
Thank
so
you
much for
all.
joining us, and thank you so much for everybody for joining us tonight.
Bye bye.
Bye for now.